Great, welcome back to House Healthcare. So we're still going over the findings, section 8 on S37. So to bring our two committee members up to speed that had to leave. So if you're on page 12, line 9, where it says subchapter 11, Pregnancy Services Center Fraud, we are getting rid of the word fraud and just saying this is the Pregnancy Services Center subchapter.
Can you say that one more time, where to find it?
Sure, page 12, row 9. It's the title.
9. Oh, the 9. There it is.
And then on page 13, row 6, at the end, a new sentence starts with many limited services pregnancy center. We're going to change that to some.
Oh.
Yep, to reflect the same as the above. There's still a question we have to go back to on number 1, but let's keep going for now. So section or finding 3.
Okay. 3, false and misleading advertising by centers that do not offer or refer clients for abortion is of special concern to the state because of the time-sensitive and constitutionally protected nature of the decision to continue or terminate a pregnancy. When a pregnant individual is misled into believing that a center offers services that it does not in fact offer, or receives false or misleading information regarding healthcare options, the individual loses time crucial to the decision whether to terminate a pregnancy and may lose the option to choose a particular method or to terminate a pregnancy at all.
Comments? Art?
I mean, come on. This is, to me, you're telling me somebody would really sit there for days and say, gee, they say they offer pregnancy and they don't, and not know what to do. I find that unnecessary, an unnecessary clutter of our statute, frankly.
Okay.
They know where to go for an abortion if they want one.
When you say they, you're talking women who are.
Yes.
Anyone else have a comment?
I will say that I find this particularly important to put in there. I mean, you are limiting, if somebody has an appointment at some place where they think that they're going to receive options, let's say they're in their 10th week of pregnancy, you have just eliminated an option for them when they find out that they can't.
How though?
How?
Yeah.
If you've gone from a medicated assisted abortion to a surgical abortion, which puts that woman at higher risk.
No, but how does this,
Timing.
It's the timing.
I'm trying to figure that out though. So these are free clinics, right? I mean, you can walk in.
I don't know. I don't
So
believe so.
I'm gonna, so I don't want to like. So,
No, I know,
so-
but I'm just trying to understand how this
So,
really affects
yeah,
anybody.
so we heard testimony from the doctor in Middlebury to this effect. And we also heard a little bit of testimony from Aspire Now when we talked about ultrasounds and who reads an ultrasound. So when a woman is pregnant, they have a certain amount of time, right, to have an abortion through medicated,
Right.
which is an easier, safer method than surgical. And so if I, as a pregnant woman, walk into a pregnancy center and I'm required to have an ultrasound. And if that information is not read properly, if a date is given that's not accurate, or if I say I want an abortion and no one tells me that they don't do abortions, the timing of all of that delay could cause me to then say, I'm not able to have an abortion. And now I'm bringing a pregnancy to term that I did not want to.
Do we have any evidence of that happening?
We heard testimony from the doctor in Middlebury.
But she had no evidence. She just said, well, I'm here and, there was no hard evidence of that.
So she had evidence talking about patients that have come before her. Lizzie.
I just want to add that sometimes a woman doesn't know she's pregnant right away.
Yep.
And there could be a large gap of time. Women might have a bleeding and think it's a period, but it's not when she's pregnant. So there can be a long period of time that goes by before a woman says, whoa, something's not good, and then moves on. So the timing is particularly important in
But I'm
that
trying to
case.
understand what we think these places are telling people that mislead them. I'm trying to understand.
So based on the testimony, sorry, Melanie, based on the testimony we heard from the pregnancy center we had come in, and by looking at their website,
Okay,
they talk about abortions.
okay,
They talk about medicated abortions, and they do not say they don't do them, right? And as a pregnant woman, I type in, I'm pregnant, where do I go?
right,
These pregnancy centers
Right.
are one of the first thing that pops up. Great,
okay,
great. I'm gonna go, I'm pregnant, I wanna keep my baby, fantastic. They do exactly what I need them to do and they help me.
right,
But I'm want an abortion
yeah,
and I go there
yeah.
and if they delay the,
Say, right, but wouldn't you say, I want an abortion, they say, well, we don't do it here, and they go to Planned Parenthood.
so what we're hearing and the testimony we heard is that they don't necessarily tell them that. That is the whole point.
Okay,
They must be informed of all of their options in a truthful manner. Melanie?
Mark, to speak to your point, like there are women that may know that they want an abortion right off and they would probably maybe go just to Planned Parenthood. But if there's some that are undecided and are trying to like look at the options and may not have the timing right or they don't know and they're in this place of real exploration, those websites offer the crisis pregnancy, offer a lot of options that may be something that they want to consider, including an umbrella of having abortion care there. And so going there maybe later than they think and trying to have all that, they may think they're getting like one-stop shopping, kind of thing. And like, I can have all of this support when in fact, now they're going to have to be referred if they do decide that they want it. So I don't feel like everyone is just going there looking for abortion. They're going there looking for information and maybe having questions. And so,
that's right.
and so if they go there and they don't have like all of that provided there and then have to refer again and they lose that window, like that's the part that's really misleading.
Okay, I mean, I disagree totally, but that's life. Get it.
The one that I looked at, provided, named all the options and so on. But in the very fine print, it said, we don't provide abortion.
Great.
And great, I think I think it needs to be blazoned on the website. I think that's fabulous. I think that is what we're asking for.
Being big.
Exactly, Chopper. I think that's what we're asking for because also people may be under duress and like not understanding. I think about when I've gone to medical pieces and heard information, you miss things or you're like not able to capture it all. And I think it just should be very obvious and very clear. We don't provide this. And so it's just helping people make an informed decision. Couldn't agree with you more.
Okay, 4.
4, telling the truth is how trained healthcare providers demonstrate respect for patients, foster trust, promote self-determination, and cultivate an environment where best practices in shared decision-making can flourish. Without veracity in information and communication, it is difficult for individuals to make informed voluntary choices essential in fulfilling autonomy-based obligations.
Comments, thoughts, Leslie?
I'm just not sure what autonomy-based obligations. What's an obligation, autonomy-based?
Can you say legally what it means?
Is it legal or is it not legal?
It is not legal. If I recall correctly, some of this was from the written testimony of Cindy Brussesi.
Okay,
The Vermont Ethics.
yeah, emphasis.
Can we think of another word than obligations? Voluntary choice is essential in fulfilling autonomy-based obligations. It makes it sound as though you're obliged to fulfill this autonomy-based.
Autonomy-based.
Agency language, but I think we can come up with something else.
Oh, did you just say agency, Melanie? Well, I like agency. Or
Something like that, because it's like you.
like a fancy word for options.
Like a decision.
Yeah, just decisions.
We're gonna let Jen and Amber have back to us. Okay, 5.
5, advertising strategies and educational information about healthcare options that lack transparency, use misleading or ambiguous terminology, misrepresent or obfuscate services provided, or provide factually inaccurate information are a form of manipulation that disrespects individuals, undermines trust, broadens health disparity, and can result in patient harm.
Art?
Yeah, again, I just totally disagree with that. I was just thinking, I wonder if do we hold drug manufacturers to this same thing? You get a thing of, no, we don't. You get a little container of drugs that says nothing on it, and you get this little fine print thing that comes with it folded in the back. Okay, if you use the same rationale here, this fine print the topper says, at least is on the website. You can't even see what your drugs do to you. It's in some paperwork that might be attached somewhere. Okay, so this is just a comment. I understand.
And I'm going to say again that some pregnancy service centers are providing accurate information, whether it's in fine print or not, and some are not.
So all of them do good work. Thank you.
All right, anyone else on number 5?
I just, tough question for council. Do you think this could have been written up in maybe one article instead of 5 and accomplish the same thing?
Do you mean a shorter version
Yeah.
of the?
You know, we're here,
We're saying the same.
we're saying the same thing, but it just seems like you've made it more confusing.
This is what the Senate committee chose to do.
Okay, no, and I'm not, but it just seems to me that all these 5 paragraphs could have been pretty much said in maybe one, and we could accomplish the same thing. But
Say that's a policy.
That's, yeah.
We can write whatever the committee thinks.
I'm not blaming you.
All right, intent.
So Section B, intent. 1, it is the intent of the General Assembly to ensure that the public is provided with accurate, factual information about the types of healthcare services that are available to pregnant individuals in this state. The General Assembly respects the constitutionally protected right of each individual to personal reproductive autonomy, which includes the right to receive clear, honest, and non-misleading information about the individual's options and to make informed voluntary choices after considering all relevant information.
So that's our intent. It's not a finding anymore.
And then the second, the General Assembly respects the right of limited services pregnancy centers to counsel individuals against abortion, and nothing in this subchapter should be construed to regulate, limit, or curtail such advocacy. And that is the end of this section.
Okay, so we have 2 things to come back to on this section. The one is on finding 1. If on line 17, we take out pregnant, and then on page 14, row 2, another word for obligation. So you'll come back to us at some point.
Yeah, I have, so I was just showing Imran on the second one, I heard the word agency over here, I like that. So I suggested instead of, on page 14, instead of voluntary choices, essential and fulfilling autonomy-based obligations, which is in there now, voluntary choices essential in the full exercise of autonomy-based agency.
Where are you?
Where are you?
Top of page 14.
Can you,
Yeah. You just
look at it again. Is everyone there? Row 2, row 1 and 2?
So revising the language that starts with voluntary choices, or you would say, I guess the whole sentence, whole line starting on at the beginning of line 1 would be individuals to make informed voluntary choices essential in the full exercise of autonomy-based agency.
Autonomy-based what?
Agency,
Agency.
like being an advocate for yourself and making decisions for yourself. We can put that in the next version.
Okay, yeah, no, that works. Let's put that in the next version. Okay. All right, and then we'll come back to 1. So I think we are now on page 14, row 19. Which I think we did go over the definitions, but we can breeze through them again.
Yes, so section 2492 definitions. First, we have a definition of abortion, means any medical treatment intended to induce termination of or to terminate a clinically diagnosable pregnancy, except for the purpose of producing a live birth.
Can you help me understand? I don't understand how the end fits in, except for the purpose of producing a live birth. I don't know what that means.
I think that's to recognize that the medical community may think of an abortion as ending a pregnancy. But that doesn't necessarily mean ending a pregnancy without having a live.
Except for the purpose of, I mean, I'm thinking about induction of pregnancy. Is that what but that would be.
I think it's clarifying that it's not. So terminating a pregnancy, it's terminating a pregnancy for a reason other than to produce a live birth.
Oh, other than.
Yeah.
Okay. It says except for the purpose, so I just got confused about except.
I mean, there are instances when you may have a medical treatment that's intended to terminate a pregnancy, but the termination of pregnancy does not necessarily mean that.
That's what it's trying to say.
We're saying other than when you terminate the pregnancy in order to have a live birth.
Remember the definition.
Yes, this is based on the Massachusetts definition. So we don't currently have a definition of abortion in our statutes.
Okay.
So this is new language and it is not clear if there's it can change, I guess is what we're saying.
Yes. So that induces pregnancy.
That induces a birth,
Yeah. That
but
ends a pregnancy.
producing a live birth. I just, yeah, I'm needing help there.
We can look at the definition and look at maybe a different one.
Or just explaining it.
What?
Or just
Just help me understand it.
Explanation of it. All right, we'll come back to that.
Thank you.
Okay.
Can I just, I think that, Leslie, I think that if you go back and you look at the word on page 21, I think they're trying to distinguish between an inducement and an abortion. I think that's why they have except for the purpose, because they use the word induce. So, I mean, if you think about inducing.
Referring to a dude.
They're
I get what you're
they're
saying.
referring to, it's terminating it other than an inducement.
So the live, so it's the
Yes.
word induce that's the
It's
problem.
the,
Word on- Okay, I think what you're saying makes sense.
Okay, would you like us to keep looking into that? Or are we comfortable with the language?
I think this only applies to a clinically diagnosable pregnancy. Am I right?
Yes.
Are you good, Leslie?
Yeah.
Okay, we're good?
So next, client means an individual who is inquiring about or seeking services at a pregnancy services center. Emergency contraception means any drug approved by the U.S. Food and Drug Administration as a contraceptive method for use after sexual intercourse, whether provided over the counter or by prescription. Health information means any oral or written information in any form or medium that relates to health insurance or the past, present, or future physical or mental health or condition of a client. Limited Services Pregnancy Center means a pregnancy services center that does not directly provide or provide referrals to clients for abortions or emergency contraception.
Can I ask a question about that? Are we saying there that a limited service pregnancy center, under no circumstances, does it provide it says referrals. Okay,
Doesn't
I was talking
give
about.
them or provide referrals to abortions or emergency
Okay,
contraception.
I'm okay.
Okay, Leslie?
Under health information, I'm back at 4. means any oral written. Does written include electronic medical record?
I think so.
Usually,
Okay, just wondering.
Okay.
Pregnancy Services Center means a facility, including a mobile facility, where the primary purpose is to provide services to individuals who are or may be pregnant, and that either offers obstetric ultrasounds, obstetric sonograms, or prenatal care to pregnant individuals, or has the appearance of a medical facility. A pregnancy services center has the appearance of a medical facility if two or more of the following factors are present. A, the center offers pregnancy testing or pregnancy diagnosis or both. B, the center has staff or volunteers who wear medical attire or uniforms. C, the center contains one or more examination tables. D, the center contains a private or semi-private room or area containing medical supplies or medical instruments. E, the center has staff or volunteers who collect health information from clients. F, the center is located on the same premises as a state licensed medical facility or provider, or shares facility space with a state licensed medical provider. And
7. Did you read 7?
7, premises means land and improvements or appurtenances or any part thereof.
Art?
Yeah, I'm trying to, I'm going back to the limited service pregnancy centers. So it sounds like they're just a referral place?
It is a place that does not referrals.
Oh, it doesn't?
It doesn't provide or refer anyone
Does
for.
not directly provide referrals to clients. Portion. Okay, so they just handle everything in-house? Is that what that means?
It means a center that might provide other support services to someone who is or may be pregnant, but they do not provide abortions or emergency contraception, nor will they refer a person who comes in to any of to either of those services.
Okay, so they just handle non-abortion anything
Okay, right.
for the patient? Okay, okay, all right, so.
And help clarify too. Yeah.
Versus the pregnancy service center, which does everything. Is that fair?
Pregnancy Service Center is a broader term. So
Right.
Limited Service Pregnancy Center is a type of pregnancy center,
Yeah, right,
but there are other types that may provide more services.
okay.
Yes, more services, but maybe not all services.
Not all, gotcha. Okay.
And we're gonna move on line 12, it's picky, but we're gonna move the comma after clients to after for, which I think will help with the readability that was confusing Representative Peterson. So it will say, means a pregnancy services center that does not directly provide, comma, or provide referrals to clients for, comma, abortions or emergency contraception.
Yeah, got it. How'd you watch those commas?
I'm a woman.
Okay, so I think we're on page 16, row 13.
All right, so now we are down to section 2494, Unfair and Deceptive Act. Sorry, 2493. Subsection A, there were no changes to this section. This is creating an unfair and deceptive act in practice and commerce for any limited services pregnancy center to disseminate or cause to be disseminated to the public any advertising about the services or proposed services proposed at the center that is untrue or clearly designed to mislead the public about the nature of services. And then it goes on to explain what advertising would include, which could be directly to consumers, marketing practices, communications in any print medium, broadcast medium, telephone, marketing, advertising over the internet. And then a statement that for purposes of this chapter, advertising or the provision of services by a limited services pregnancy center is an act in commerce. And that is our way of saying we recognize that they may not charge for any services, but we still consider it to fall now under the consumer protections. Okay.
The limited service language for any other type of thing that you know of? I mean, are there things other than limited service pregnancy centers, other types of businesses that might be limited service?
I do not
You
know
don't
without
know.
looking.
I didn't think you would. I just was curious as to whether this is this is obviously specific to this, I just want, okay.
Okay, anything else on A before we go to B where there's some language change? Okay,
Subsection B, now on page 17. This is based on testimony from the Office of Professional Regulation yesterday, I believe. So we would be striking out all of the current language in the Senate version of S37 and instead replacing it with, it's similar in the intent in terms of using or creating potential enforcement for practices under the professional standards as enforced by the Office of Professional Regulation and the Board of Medical Practice, but it is worded differently. So the new language would say healthcare providers licensed under Title 26 of the Vermont Statutes Annotated who are employed by, contracted to provide services for or on behalf of, or volunteer to provide services at a limited services pregnancy center shall be responsible for conducting and providing healthcare services, information, and counseling at the center. The failure of a healthcare professional licensed under Title 26 of the BSA to conduct or to ensure that health services, information, and counseling at the limited services pregnancy center are conducted in accordance with state law and professional standards of practice may constitute unprofessional conduct under Title III, Section 129A, which is OPR's unprofessional conduct standards, and Title 26, Section 1354, which is the Board of Medical Practice Professions unprofessional conduct statutory provision.
and these are for licensed professionals.
Yes, but I would suggest that we add registered and certified, like we do on other stuff too, especially like registered nurses. So I know this, I think this was OPR's language, but I think yes.
So once you have that written out, can you just say that what you're gonna add?
Yes, in two places where it talks about healthcare providers licensed under Title 26 of the VSA, so on pages 17 and 18, we would just add, so it would say healthcare professional licensed, registered, or certified under Title 26. So we make sure we're getting the whole scope of regulation type.
What does registered mean?
Like a registered nurse. I mean, I think they're licensed too, but some professions have a registration rather than than licensure, or certification rather than licensure. So usually when we're talking about, at least with healthcare professionals, we usually use all three of those terms.
Art?
What, I'm trying to figure out what this does to one of these centers. What do they have to do? As an example, someone,
Right.
patient comes in.
So it's only if there is someone that is licensed, registered, or certified, a healthcare professional, licensed, registered, or certified.
At
This
that center.
at the center that this applies to, or volunteers for the center,
Right,
or provide services.
and that's,
So they are,
so what do they have to tell the patient? I guess that's kind of where I'm at. What do they have to,
don't think it's saying what they have to tell the patient. It's that they have to ensure that healthcare services, information, and counseling are conducted in accordance with state law and professional standards of practice.
and what does that mean? When you say in accordance with state law, so would they have to say, it's the law of the state that abortions are legal? You don't provide it here, but you can go there for it.
This does not direct, the healthcare providers to say any one thing. I mean, so the first part, the first sentence of this is saying that healthcare providers who are employed or contracted or volunteer at these places
Right.
are responsible for conducting healthcare services and
Okay.
information and counseling.
Okay.
And
Okay.
then the next sentence is saying that a healthcare professional who fails to conduct or to ensure that those services, information, or counseling are conducted or provided in accordance with state law or standards of practice they could be subject to discipline by OPR. I don't think it changes what is currently the law, but
Oh, all
it's making
right.
it clear that if you are a healthcare professional who's working here,
Okay.
then you need to make sure that healthcare services that are being provided are being done
Okay.
according
Yeah.
to state law
All right.
and standards of practice.
Okay.
And it says it may.
Yes, often the unprofessional conduct will say may because there may be mitigating circumstances why, simply because the person failed to do it, does not mean that they need to necessarily be disciplined. They may still be investigated and it may be determined that there are reasons why they were not able to.
So it's not automatic.
No, it is not.
Yeah,
They would go through the full investigation process if there was a complaint.
Again, nothing outside of what we do today for licensed professionals.
No.
Right, and I will note, it triggered something, Representative Peterson's question reminded me, there is a provision in Title 12, so this is in the medical malpractice context, but applies generally, that says a patient shall be entitled to a reasonable answer to any specific question about foreseeable risks and benefits, and a medical practitioner shall not withhold any requested information. So that comes up in other statutes as well. But just so if somebody's asking a question about their options, and what are the risks and benefits of the options, then that information needs to be provided.
yeah, but it has to be done by somebody that knows what they're talking about, not just somebody that's in a place.
It says medical practitioner, right?
Does it?
So how does the law apply if a person's unlicensed, registered or certified?
If they are providing a service that's within the scope of practice of a licensed professional and they are not licensed, then it may be unauthorized practice of medicine, which is separate from unprofessional conduct discipline, but is also enforceable through OPR and the Board of Medical Practice, and possibly, I don't know whether it's civil or criminal,
It could be.
possibly other, but
Could be
depending on
assault.
what happens, it could be. So in that scenario, there would be a different enforcement mechanism.
Thank you.
Anything else on section 8?
Well, I just want to make it clear, in my mind, if you are not trained and you're not licensed, you shouldn't be talking about the effects of abortion or any other medical thing that may be wrong. You should keep your mouth shut because you don't know what you're talking about. In my opinion, if you're a medical person, you've got a degree in it, you're practicing it, there's a scope of practice that you're involved in, you deal with what you're doing there and not get involved in other stuff. That's how I feel.
Great. I agree. People agree with you. I think most of us agree with you. Okay, let's go. So now I don't think we have to go through line by line, these next sections. We can just go to the places that are changed.
So section 9 has no changes because this section was flagged for further discussion.
Oh, right, I forgot about that. I was wondering.
We're not done yet?
Let's go back. Let's get back to that.
So do you want to pass over section 9
Yeah,
for the
let's
time
pass
being? Okay. So next is section 10, Board of Medical Practice, Office of Professional Regulation, Interstate Compacts Report. There was a request from the Board of Medical Practice that OPR also agreed with, that the date for the report about the state's participation in interstate licensure compacts be pushed to November 1st, 2025, as many of the compacts that the state is entering or contemplating entering are not going to be up and running and really implemented until at least 2024.
Yep, makes sense.
So that's just changed to 25.
Yep, that is the only change. The next section is 10A. And the changes are, okay. This is concerning the state's direction to Vermont representatives or delegates representing Vermont on interstate compact commissions. So first, there were some findings about the reason for having a direction to the delegates about amending compacts or rules or bylaws to better permit providers to continue providing legally protected healthcare activity. There was a concern from the Office of Professional Regulation about the language here and first of the intent. Currently, it says, therefore, is the General Assembly's intent to protect the ability of professionals licensed, certified, or registered in Vermont and applicants from other member states seeking to practice the profession in Vermont pursuant to a compact or agreement. And OPR raised the point that under compacts, people are not really considered applicants when they're coming in from out of state because they are exercising a privilege to practice. So I changed that to professionals rather than applicants. And I believe the Office of Professional Regulation may have raised the issue of whether this one phrase is necessary because people who are not actually practicing under the compact are not entitled to the benefits of the compact yet anyway. But I think for purposes of someone seeking to exercise a privilege to practice, knowing that Vermont is working towards continuing protections for legally protected healthcare activities may be important and may affect their desire to participate in the compact. So I left it in, but OPR did raise that concern, so I am also open to taking it out because it is true that the compact provisions will only apply to someone who is actually practicing under the compact. It is intent language here, so I don't know that it makes it doesn't make a substantive difference, legally
I
speaking.
mean, I'm fine either way. I don't know if anyone has any thoughts on this. I say, go ahead.
If it gives us more opportunity as we move forward, then I would think about leaving it in. It's sort of like what does it do as we move forward? How does it help? How does it help people wanting to be part of compacts in the future?
Well, first, I think the helping people who want to be part of compacts in the future is really in subsection B, where we're making the direction to the delegates. And subsection A here is a description of why the General Assembly wishes to do this. Enact subsection B, which is to protect the ability of professionals who are already licensed here and those professionals from other member states who might want to be practicing under a compact here to have the benefit of compacts and agreements while also engaging in legally protected in gender affirming healthcare and reproductive healthcare.
So by leaving it in, it supports B.
I believe so.
Okay, that makes sense to me.
Makes sense. We'll leave it in.
Subsection B has what I would describe as some clarification language. Right now, subsection B says Vermont's representative or delegate for an interstate compact or agreement related to healthcare shall seek an amendment or exception to the compact or agreement language, rules, or bylaws as necessary. The Office of Professional Regulation read this language a little differently than I had intended in drafting. I meant language, rules, or bylaws of the compact or agreement, but that's not how it was read. So I have switched the language a little bit to be a little clearer. And also the Board of Medical Practice mentioned that there might also be directives. So the new language would read, Vermont's representative or delegate for an interstate compact or agreement related to healthcare shall seek an amendment or exception to the language, rules, directives, or bylaws of the compact or agreement as necessary, so that if a licensee is disciplined by another state solely for providing in or assisting in the provision of gender affirming healthcare services or reproductive healthcare services that would be legal and meet professional standards of care if provided in Vermont, the compact or agreement does not require that Vermont take professional disciplinary action against the licensee.
Questions, comments? Okay.
Now I'm going to pass the torch to Jen, but I can
Great,
that would be
thank
great.
you, that'd be great. All right, now we get into emergency contraception, section 11. There were no changes in section 11. This is the section that allows pharmacists to prescribe emergency contraception. Section 11A is the section on emergency contraception in vending machines, and this is the change that you heard about on lines 12 and 13. OPR yesterday would add in notwithstanding language, so notwithstanding any provision of subsection 2032H of this chapter to the contrary, the board may, and this is the Board of Pharmacy, may adopt rules to regulate the location, operation, utilization, and oversight of the vending machines and similar devices described in subsection A in a manner that balances consumer access with appropriate safeguards for theft prevention and safety. And that provision that's being notwithstood is a provision in another part of the pharmacy statutes that says, in a fairly roundabout way, but that the Board of Pharmacy shall not adopt any rule that relates to non-prescription drugs. So here's a place we're saying, except in this one instance, they can't. So notwithstanding, disregarding that one piece, that piece of broader provision saying no rules on non-prescription drugs, they may adopt rules in this narrow instance.
We talked about that a little bit yesterday. Any questions or comments? Okay.
Section 12 is the section on the public universities reporting on access to reproductive and gender-affirming healthcare services. We have some definitions. There are no changes to the definitions, if you want to go through them all. Just I think one small change so far, at least in this section on page 24, in section 2502. These are the things that the public institutions are reporting on annually regarding the current status of their gender-affirming healthcare and reproductive healthcare readiness. In number 6, down on line 20, there was concern about whether referral information that the institution provides about other facilities or facilities that offer these services, if a referral was too specific to meaning a provider referral. So I just took it out. I don't think it's necessary there. It would just say the information that the institution provides regarding facilities that offer gender-affirming healthcare services and reproductive healthcare services that are not available to students on campus.
Is everyone good with that?
I'm just,
Leslie? No, go ahead.
oh, sorry. I just wanted to understand, and this came from the Senate, obviously, and I could talk from someone there, what the goal is of this section, which I don't know that I understand.
I think there was interest in understanding what services are being provided or made available and how they're being made available to students who are, roughly ages of 18 to 25, maybe depending on the program that they're in, who may be looking as a particular segment of the population to be accessing reproductive healthcare services and gender-affirming healthcare services. And so looking to understand what's going on and whether there are gaps and how, for you to be able to look at whether there are gaps reaching those age groups. And then you could make decisions about how you might want to deal with them.
But the gaps, if I understand right, are only people attending these specific universities or educational places.
Right, that's what this piece.
That's what this piece is
It
directed
seems
to.
like it's sort of like hanging out here to me, but.
I think we want to understand what universities are doing. They're going to report.
Yeah, I
We'll
mean,
look at it next year and see if there's anything we can take from it. Art?
No, actually, no, I was waving to Bobby, see if he would open that window.
Oh! When he said no, I was like, no, what?
That's usually on the line.
Exactly.
I'll save my question for the.
All right, so, anything else on, I'm sorry, I lost my page now. We're on section 17, right?
Section 12.
Well, 17, where'd 17 come from? 12.
Page 25.
Exactly.
so many.
There is no 17.
25.
So any other comments or thoughts on?
Well, there's,
Something about, disease that can be transferred sexually.
STDs.
Didn't we mention that?
So we had talked about, there was some concern, there was some discussion about maybe adding it some places.
Yeah,
And I think we didn't really go very far on that, and I think it might be outside of what we have in front of us here. But I don't really remember what sections we were talking about it.
I thought it was in here. I don't know why.
Does anyone remember?
I'm looking.
it was somewhere, I
I
thought.
believe it was Brian that brought it up.
It was Brian that brought it up.
I might not have gotten to it
A
yet.
good point. It was around, there was
What about section
somewhere,
14?
Right on the line.
He's testifying.
Oh, right.
it was around, rape. Someone mentioned rape or,
All right, so let's, since he's not here, let's come back to that.
Lori, I do have a question.
Sure.
And kind of what Leslie was talking about, the goal of the section, and I understand, but do we, and you know, call me old fashioned, but we're concentrating on a piece of our society that I hope is relatively small in terms of the abortion piece certainly, but do we require these types of things for propagation of families, for these types of things in this age group? I'm just wondering, I mean, it looks like we're making a special effort with these two healthcare types, and I don't, well, I kind of get a feeling why, but I don't, it seems to me we would, I don't know, I think this is one area really needs study. I think, I hate studies a lot of times, but it seems to me we need to look at the overall future of what we want our state to be, and not only promote these types of services, but other types of services too.
So
I just wanted to throw in there that we're asking them to report on gender affirming healthcare and reproductive healthcare readiness. And if you look at the definition of reproductive healthcare, it includes anything relating to pregnancy, contraception, assisted reproduction, pregnancy loss management, and termination. Reproduction,
everything.
it's everything. It's what you want.
All right.
Yeah, that's what I was gonna do, so that's good. All right, so I think what is important, because although it is a small part of our population, it is a part of our population, right? I don't know how many people go to school here, and I know I went to school outside of the state where my family lived, and wanted to be able to have, access to healthcare services. So I think it's just saying, what do we provide access to? And how do we help people in any stage of their reproductive health? And I think we get a report next year, and if we don't feel it's necessary for them to keep doing, we change it.
And it's gender affirming healthcare
As well, yeah, as well.
Could I just comment? They're gonna have to do this work, which, and at UVM, my understanding is that, they have a pretty comprehensive system and they have a referral base and they're in pretty good shape. State colleges didn't seem to have anything. I didn't really get a sense that they were providing any.
They don't have a healthcare facility on it,
Oh.
right?
That's Castleton has something, but it wasn't really,
It seemed pretty
fleshed out.
minimal. I mean, I don't want them to have to do a report every year and for us to forget that there's a report, which can happen, and that they have to end up, yearly doing stuff. So I just want to be thoughtful about what we're asking them to do and how we intend to use that information, and that's what I'm thinking about.
So are we asking for it each year?
It is each year, but under our sort of default reports statute in Title II, they'll get revisited after 5 years about whether it's still a useful report or not. So you'll have you or whoever's in your seats, will have an opportunity to visit whether it still feels useful. And if before then you decide it's not, we can always stop.
Get rid of it.
I would just say kind of to what you said a little bit, the Vermont State College system it's in trouble, some of it. And anything, I would hope that we would never do anything here that would be a requirement that would cost money because they don't have it. Doesn't sound like we are.
We are not in that, oh, crap.
What's that?
Because
Oh,
it's
there.
Attention, please. May I have your attention, please?
You have our
This is
attention.
Evacuation